So hello everyone, I am Ray Kenneth Ligan and I will be discussing about public health bag and bag technique. So first, let us define these following terms. So public health bag is an essential and indispensable equipment for a public health nurse which he or she has to carry during his or her home visit. So this bag contains basic medication and articles that are which are necessary in providing care. So aside from that, bag technique is a tool making use of public health bag in which through a nurse during his or her home visit can perform a nursing care with ease and deftness, saving time and effort, and of course with the end in view of rendering effective nursing care. So the purpose of this bag technique is to carry essential equipments and materials during a visit. It could either be for a school, for a factory, or for a certain community. Furthermore, bag technique is useful in making tests and to demonstrate a nursing care such as wound dressing, eye irrigation, injection, or urine testing. Now this time, I will be showing you how to arrange the following equipments and materials inside the public health bag. So this is the left lying compartment, the center lying compartment, and the right lying compartment. So first, we need to put the alcohol lamp in the left lying compartment. So this is the alcohol lamp together with the denatured alcohol. Now, in the center lying compartment, we need to put the 70% alcohol solution and also the Benedict solution and the acetic acid solution and also the Providone iodine. So this is the Providone iodine, the hydrogen peroxide, and the spirit of ammonia. Now, in the right lying compartment, we need to put the two containers for cotton balls, which is the dry and the wet container. So we have the dry container and the wet container. So we need to put this in the right lying compartment. And also the two medicine caps. Now, aside from that, we need to put the two pouches with contents. So the first pouch, it is empty. So we need to put this, in the first pouch, we need to put the 1 cc tuberculin syringe, the 3 cc, 5 cc hypodermic syringe, the 10G, 23G, 25G, and the 26G hypodermic needles. So here is the syringes and the needles. So this is the first pouch. Now let's go to the second pouch. So in the second pouch, we need to put the KY Jelly Lubricant Sachet, the tourniquet, the cotton applicator sterile, the tongue depressor, the cord clamps, tape measure, 3-meter Durapur, the plaster, the elastic bandage, the 3 inches gauze bandage, the roll 1, baby tags for boys, baby tags for girls, baby tags for mother, and rubber suction bulb. So here is the lubricant. So lubricant sachet. Next is the tourniquet. Since I don't have the tourniquet, I will just improvise. Next is the tongue depressor. So this is the tongue depressor. This one. The cotton applicator sterile. The cord clamp. The tape measure. The Durapore. So I don't have the actual Durapore. This is only a micropore. I think they are just the same. So next is the plaster. So plaster. So next is the 3 inches elastic bandage. The 3 inches gauze bandage. Next is the baby tags. So I have here the baby tags for boys, baby tags for girls, and baby tags for mother. And the rubber suction bulb. So this is the second pouch. So we need to put this here. So this is the muslin pack. We have here the straight forceps, the curved forceps, and lastly we have the surgical forceps with the medicine tray. So this is the anterior portion. So next is we need to put the above layer. We need to put the soap dish, the medicine or the medium emesis basin. So after putting the anterior portion, we need to put the above layer. So we have the soap with soap dish, the medium emesis basin, the apron, and the hand towel. So we have here the hand towel. So that is the hand towel. Next is the apron. The emesis basin, this is the basin that I have. The soap and soap dish. So after that, we need to put the left lying or the left standing compartment. So in the left standing compartment, we have the baby weighing scale. So this is the weighing scale. So we need to put it here in the left side. So next is we need to put the digital thermometer and a bandage scissor. So we have the digital thermometer here. Digital thermometer and a bandage scissor. This is in the center standing compartment. So next is the right standing compartment. So we need to put the test tube holder, and the medicine dropper. So this is the test tubes. We have the medicine dropper and the test tube holder. So we need to put first the test tube, the medicine dropper, and the test tube holder. Now, after that, we need to put the upper compartment. So we need to close this. So we need to put the outer layer. We have the manila paper or the paper lining and the plastic lining. The paper lining and the plastic lining. So here in the upper compartment, we need to put the sterile gloves, the 4x4 gauze pad, the 2x2 gauze pad, the white sando bag, the matchbox, and the waste receptacle. So this is the surgical gloves, the gauze pad, another size of gauze pad, and the white sando bag, the matchbox, and lastly, the waste receptacle. Now we need to close this. So hello, I am Ray Kenneth Ligan, and I will be discussing or demonstrating the following procedures with its rationale during a home visit. The first thing that you need to do is to greet the client because it helps build rapport and promotes comfort. So maayong buntag, ma'am, sir. Ako di ay si Ray Kenneth Ligan, usa ka estudyante sa Cebu City Medical Center College of Nursing. Next is to explain the purpose of the visit because this decreases the discomfort and anxiety. So maayong buntag, ma'am, sir. Ako di ay si Ray Kenneth Ligan, usa ka estudyante sa Cebu City Medical Center College of Nursing. Aniya ko karon sa inyong balay para mutabang og ayuhon ang imuhang mga samad sa imong kalawasan. Now, upon arrival at the client's home, place the bag on the table, lined it with a clean paper topped with a plastic lining. The clean side must be out and the folded part touching the table. So this will protect the bag from getting contaminated. Now ask for a basin of water or glass of drinking water if tap water is not available. So this will be used for hand washing. Now put the bag on the table and open the bag and take the towel and the soap. So this will be your preparation for hand washing. Now wash your hands using soap and water. Wipe to dry to prevent contamination of microorganism from healthcare provider to the client. Now take out the apron from the bag and put it on with the right side out. This will protect the nurse's uniform. Now after that, put out all the necessary articles needed for the specific care. So to have them readily accessible. Now after that, so you need to take out also the waste receptacle. So place it at the side of the table. So as you can see, I don't have the chair or something that I can put on my waste receptacle at the side of the table. So I just put it in the away from the table. Now after you take out all the necessary articles or equipments, close the bag and place it in one corner of the working area to prevent from contamination. Now proceed in performing the necessary care and treatment to provide comfort, security, and hasten recovery. After giving the treatment, clean all the things that were used and perform hand washing again to protect the caregiver and prevent infection. Now open the bag and return all the things that were used in proper places after cleaning them, so prevent contamination. Remove apron, folding it away from the person, the soiled side in and clean side out. Place it in the bag and to prevent cross-contamination. So remove the bag from the working area. This will prevent contamination or for proper disposal. Now fold the plastic lining and the paper lining and place it in the bag, so prevents contamination. Now after that, have a talk with the client. Write down the necessary data that were gathered, observations, nursing procedures, and treatment rendered. Give instruction for care of client in the absence of the nurse. This will provide understanding and promotes continuation of care for the recovery of the client. And after that, make an appointment for the next visit, taking note of the date and time to follow up care and ensures that the client has fully recovered.